Good evening, ladies and gentlemen. I'm Jeremy Ladner, and on behalf of Mayaneha Hayeshua, I'd like to welcome you to the COVID conundrum, fighting the physical and mental health effects of the pandemic. When the first wave of COVID-19 pandemic struck Israel in early 2020, Mayaneha Hayeshua Medical Center found itself in the eye of the storm. The independent community hospital, with just 2% of the country's hospital beds, is nonetheless handling over 10% of Israel's COVID patients. This evening, we'll speak with key players in what Professor Eliyahu Sorkin, the director of the hospital's intensive care unit, describes as the war on COVID-19, and we'll learn about the physical and mental health challenges facing the hospital. But first, we'll open with words of welcome from Dr. Roz Landau, co-chair of the British Friends and co-chair of the Anglos and Israel Friends of Mayaneha Hayeshua, followed by David Brown, president of the Canadian Friends of Mayaneha Hayeshua.
On behalf of the International Friends of Mayaneha Hayeshua, including our chapters in the United Kingdom, Canada and Israel, we are delighted to welcome you to our first international Zoom event. We are living in unprecedented times, with the huge impact the global pandemic has made on our daily activities and on our physical and mental well-being. Tonight we are privileged to hear directly from Mayaneha Hayeshua's medical heroes, who have been confronting COVID-19 day in and day out. Our panelists are all specialists in their fields, and we look forward to hearing from them and to learning how the hospital has been coping during the pandemic.
Welcome, and thank you for taking the time to join together with us to learn about the Mayaneha Hayeshua Medical Center, a public community hospital located in Bnei Brak, and its ongoing and evolving unique response to the COVID-19 pandemic in Israel. Located in the Israeli epicenter of the pandemic, the hospital continues to treat a disappropriate number of patients compared to other facilities of its type. Of the 300,000 to date recorded cases in Israel of COVID-19, the capture area that the hospital services has accounted for over 20,000 cases of the dreaded virus. But it's not just the sheer volume of patients that makes the story of Mayaneha Hayeshua so compelling. It is rather the way that the hospital's professionals treat their patients, with a holistic approach of dignity, respect, and of course, the highest level in medical care. From the doors of the emergency department to the busiest birthing rooms in the country and the most advanced Israeli medical health facility of its type, Mayaneha Hayeshua has extended its over 30-year philosophy of compassion, empathy, and cultural sensitivity to all who walk through its corridors. Our task is not easy. We are learning and adapting as we develop new strategies and approaches every day. But one focus has not and will not change. It is the unifying belief among the founders, department heads, physicians, staff, and supporters of this institution that human life is precious and that modern medicine with advanced technologies can be combined with preserving the richness of our halacha for the betterment of all. Thank you, and please enjoy our presentation.
Thank you, David. Before introducing our panel of experts, we have a short clip of Mayaneha Hayeshua's immediate response to the COVID pandemic, setting up a dedicated field hospital for coronavirus patients and creating an in-house COVID-19 testing laboratory, all done in just 24 hours. Tonight's first guest is the director of Mayanei, Hayeshua's all-important Department of Emergency Medicine, Dr. Ronan Lipster. Dr. Lipster, thank you very much for joining us this evening and starting off the program. We're happy to have you as our first guest.
Good evening.
Good evening. We understand from early press reports that Mayaneha Hayeshua handled a disproportionate number of COVID-19 patients during the first wave. Can you share a little bit with us about how you and the emergency room staff dealt with that, and perhaps what lessons may have been learned that can be applied to the second wave that we now find ourselves in the midst of here in Israel?
Okay, we are a hospital of 300 beds, and in the first wave, we had 290 COVID-19 patients. So for a hospital of our general, it's a huge number of patients. If you think that we continued to deal with the other patients, which were not COVID-19 patients. So we had to treat the COVID-19 patients and those who were, let's say, regular patients with the regular diseases, those patients that come to the hospital every day. So we knew quite in the beginning that in the emergency department could not cope with such a number of patients, and we cannot isolate COVID-19 patients in our emergency department. So we had to build another emergency room outside the emergency department. We have 12 beds in the emergency department, and we had another 15 beds in the additional COVID-19 ER, let's say, okay? And the same staff had to treat the patients in the two emergency rooms. We had a little help of nurse. We had one or two doctors, which were interns in the hospital, and they came to help us. But it was the same staff that had to handle the two emergency departments. And we have to shift from one emergency department to another emergency department according to the number of patients in each facility. And it was quite hard. And of course, when you have to work wearing personal protecting equipment, it makes it harder because it's heavy. You sweat under the gear. You have the spectacles that you can't see through them, and the patients cannot see you. They don't recognize you. You speak to them, and they don't know who you are. And it's very difficult. And you have always to say, I'm so-and-so, I am the doctor, this is the nurse, her name is so-and-so. And it was quite a burden working like that. We continue to work like that even today because we wear the personal protecting gear even today when we treat patients, because every patient who comes to the emergency department is supposed to have COVID-19 if he has fever or some sort of symptoms of febrile symptoms or symptoms of infectious disease.
So I understand that in the best of times, working in an emergency room is challenging is an understatement, obviously. The hours are excruciating, the pressure is intense. Add to that, as you say, the fact that suddenly the number of beds and patients you're dealing with has more than doubled, and you're add on top of that the protective gear and the fear and the deep, grave concern that all these folks are coming in there with, plus your own safety that you've got to be worried about. Now I understand that from the Ministry of Health, you're being asked to add an additional 60 beds to the intensive care unit. Is that correct? And how are you going to cope with that?
Yes, according to the emergency doctrine of the State of Israel, each hospital should be able to increase its bed in 20% at any given moment. So we have 300 beds and 60 beds are 20% more than our regular capacity, and we are doing it. we are able to do it, and we are doing it, and it works.
I applaud you, and obviously all of us here in Israel are very grateful, and we look on with amazement and pride at what you're able to do, and God bless you. The question must be asked, what sort of emotional toll does this take on you personally and your staff? How are you coping? How are you handling that? And at the end of the very long day, when you finally get to go home, how do you deal with it? How do you recharge and prepare for the next day that is coming?
It's very hard, of course, and we don't see the end of it. That must be said. The COVID-19 will remain with us for months, I think, maybe even for years, if we don't find a vaccine. And we have to do it, and we speak to the staff. We try to give them, to encourage them, and that's what we have. We can't send them to a vacation, because if we do, we don't have another staff. So everyone stays and works with our, let's say, we thank them. We say we know how much it costs them in their personal life, and we hope that they will cope with it for several months ahead.
Well, we are all deeply grateful for the job that you and the emergency team are doing. Please send them our thanks and our gratitude, and thank you, of course, again for being part of this evening. We appreciate you sharing some of your insights and knowledge with us. Thank you, and God bless you and the whole staff at the hospital. Really, truly, we certainly appreciate it.
Thank you for having me.
Thank you. Our next guest is Professor Rael Strauss, an internationally renowned psychiatrist and medical director of the hospital's mental health center. Professor Strauss, thank you very much for taking the time to join us and being a part of the event this evening. We certainly appreciate it.
Pleased to be here.
Social distancing, it's a challenge for all of us. It's a term that we've all become very familiar with, whether it's social distancing at the supermarket or on public transit or in our local plaza or mall. It is a new reality that we're all dealing with in our own way, and I would imagine that in the confines of a hospital or medical center, it is even more pressing and difficult, perhaps even more so in the treatment of mental health. How have you and your team been able to tackle that challenge?
This is an important point. Much of mental health treatment is predicated on a connection with the patient, both in terms of being with them physically, but on an emotional and empathic level as well. So social distancing interferes with that. So we're managing, but at the same time, we have to maintain a safe environment for treatment. So I think one can look at this approach in terms of how we're dealing with this in an outpatient department setting and an inpatient department setting. So there's an outpatient, patients can come to the clinic. We ensure that both the patient and the mental health caregiver are wearing masks, keeping 2 meters apart, and they're safe, even if one of them are suffering or have the COVID-19 virus, and the other's not going to get sick and don't need to go into isolation. The other creative approach we're doing to this is to encourage telepsychiatry. So both patients can come into the clinic, and the mental health caregiver is either some other part of the clinic or at home, and then they're talking with the telepsychiatry, seeing the therapist, and the therapist also sees the patient very clearly through the video. Or sometimes the patient can be at home, or the therapist can be at home, and then it's done from home to home, home to clinic. So many different approaches, and it works excellently. And patients are very happy with it. And this is something that I think will continue after the COVID-19 crisis. In the inpatient is more of a problem, because much of the treatment on the ward is around the connection in terms of rehabilitation. So patients are encouraged to have the social contact. But we need patients and staff to feel safe that new admissions that are coming into the ward are not bringing in the virus. So before any admission, all new admissions are tested for the coronavirus. They stay in isolation for those few hours until the result comes through, and then they can enter the ward milieu. Staff, on the other hand, who do go home every day, who potentially could be infected in an environment outside the hospital, have to at all times wear a mask and keep the 2 meters distancing from patients whenever possible. In terms of groups, for example, patients themselves can be closer to each other. They've all been tested, they're all negative, but the staff keep the 2 meter distancing, and that's how we get around that part. And whenever there are visitors, the visitors come visit outside the context of the ward. We have a clear open area, and once again 2 meters and masks. Both sides are wearing 2 meters and masks, so we encourage and allow connection with the families, but within a safe context of social distancing.
In the early days of the pandemic, you went on record saying that there needs to be a fundamental change in the conversation between physicians and community leaders, specifically rabbis. Would you mind taking a moment and elaborating on that for us?
Excellent question. About 2-3 years ago, the International Medical Oath was adjusted, and they added one of the 3 new criteria that were added as ethical duties of doctors was to share their knowledge with the community. In other words, the doctor should not just see the sacred spaces treating the patient in the treatment room, but actually sharing their knowledge with the community. That is considered an ethical duty for a doctor. So what happened in the early days of the coronavirus crisis is that many in the community were disregarding some of the political structures and in terms of giving orders in social distancing, masks, etc. And people criticized many of these communities for not adhering or blatantly flouting these guidelines of the Ministry of Health. And the problem was that the doctors were not going out of their safe space in the hospital or the treatment room and reaching out to the community and explaining that. And that's a duty of a doctor, because the community trusts the doctor, whereas the community often doesn't trust the political structures and the bureaucracy. So as medical physicians, we felt a duty to reach out to the community in many different opportunities. We did that, both from the medical perspective as well as the psychiatric perspective. And while initially the community disregarded many of these guidelines and restrictions, once the doctors did reach out to the community leaders in the terms of deliberative democracy, discussing, sharing their knowledge and sharing the importance of this, that's when things started to change. So people trusted the doctors, whereas people didn't trust some of the administrative bureaucratic structures. So that's an example of how doctors reaching out really made an absolute difference. And I'm not just talking about public health doctors. The individual doctor themselves reaching out can make a massive difference. And that's something in terms of beneficence for the patients, looking out for the good of the patients is not just in the emergency room or the treatment room, but it's actually reaching out to the community. First of all, we have to make sure that no harm has been done to patients. And in this situation, making sure no harm is reaching out and sharing our knowledge and explaining what really we're dealing with here. This is the black swan of our generation in terms of medical practice. And we need to change our approach and sometimes reach out. And that's what we encourage both in the center of the country and the periphery. And we try to carry this out both on a practical level as well as writing about it in the ethical literature.
It's certainly a challenging situation, and once you mix in the politics of it and the challenges that certain communities, our community presents, it is a lot of juggling that needs to be done, and that outreach to the community is vital, absolutely, and I'm so glad to hear that you're doing it. With all of the lockdowns and the devastation to the economy, not to mention the actual physical health of the people who are suffering with COVID-19, what do you imagine the long terms of the mental health effects will be on our community post-COVID-19?
So I think you can approach look at this from a number of different perspectives. First of all, there's initial and neuropsychiatric consequences that we see sometimes from the initial infection, which lasts long term in terms of depression, anxiety, even psychosis in certain situations. And that's more the medical biological sense. But there's this whole kind of psychological long-term consequences, which people also need to take into context. That everyone's routine has been changed. This is uncertainty. People don't know what's going to happen. People don't know what's going to happen around them. People's livelihood has been affected. People being thrown off balance by being stuck at home. We see that there are a lot of issues in terms of violence at home, sometimes marital conflicts, and these have long-term consequences on the whole kind of milieu of what's going on with people's lives in their home environment as well as in the community. And these are things that we are challenged and we have to deal with at a long-term perspective. There's this issue of the youth who've lost faith in many of the adult structures and adult power figures who some see as making a mess and lack of order in terms of situation with the guidelines changing all the time. And unfortunately, these are things that we're looking at long term in terms of suicide. While initially sometimes there's a decrease in suicide, just like we see in times of war, where the threat is externalized. It's like I'm not alone. The threat is something outside. So suicide actually decreases often in terms of war. And once the initial crisis sets in and people realize that they're in here for the long term, then suicide can actually increase. And that's also, unfortunately, where there's some frightening, concerning statistics that are coming to light that maybe suicide ideation and carrying out these acts are actually on the increase. But there another approach is to say, okay, so we are faced with this long-term crisis. How do we deal with this? And sometimes what we can help the community both on an individual as well as a social national basis to say, okay, so in life sometimes we don't have control with what happens to us, but we have control of how we deal with what happens to us. So in the mental health community, we're encouraging people, both an individual as well as a community level, to say, okay, so we are faced with this challenge. Maybe we can look at this as an opportunity. We can look at this opportunity both on an individual basis as well as a family or community base to say, maybe we can deal with things in a better way. And things can actually be encouraged. People can actually be encouraged to find some kind of meaning in this crisis and come out of this in a stronger way. We encourage both the child and the youth at the youth level as well as the adult level, and the adults can serve as a role models for children in terms of dealing with a crisis in a more healthy and a functional manner long term.
Professor Strauss, I am always grateful for the opportunity to speak with you, and this evening is certainly no exception. Thank you for sharing your insight and experience with us all.
Thank you.
My pleasure. Our next guest is Rabbi Yosef Hoffner, the on-call director of Mayane Hayeshua's Halakhic Response Team. Good evening, Rabbi Hoffner.
Good evening to you, Jeremy. Good evening to everybody who's watching us.
The late Dr. Moshe Rothschild always insisted that there was no contradiction between medicine and halacha. How does this translate into the daily activities at the hospital?
Not only there's no contradiction, the contrary. I think medicine and halacha complete each other. No rabbi can answer medical questions without a doctor, and no doctor can decide ethical questions without a rabbi. Let's say if somebody comes to me and he asks me, can I fast in Yom Kippur? I'll tell him, I can't decide by myself. I need a doctor. I need a doctor for that. If somebody comes to a doctor and says, look, I don't know if my older father, to resuscitate him or not to resuscitate him, to make an operation or not to make an operation, it's an ethical question. So he'll, together with the rabbi, who they'll have to decide. It's one you can't do without the other one. I want to tell you something. We feel like a team. We feel like a team, the rabbis and the doctors. We want to one result. The best medical best medical approach for the body and for the soul. Every patient who's over here in Hayeshua gets both aspects of medicine for the body and for the soul.
Excellent. Treating every patient with dignity is an integral part of the hospital's ethos. How does this work in practice?
Dignity is dignity, love, and sympathy for every patient is part of the halacha way of doing things. It says in the pasuk, "Ruach ish yichalkel machaleu." The spirit of a person will heal his sickness. We have special halachot because of that. Like let's say if a lady who comes to have a birth, and she needs for her spirit, she needs her mother to come with her. She can come on Shabbat. Her mother, even though she's not a nurse, she's not a doctor, she can come to be with her. Or let's say if somebody is an old person who's sick and he needs somebody to be with him, your blood will be mechalel Shabbat to come to be with him. The love and the feeling of the patient is very, very important. But I think even more important is in psychiatric ward. Over there, it's built to the building, the way that patients are treated are special for dignity of these patients. These patients get the best treatment with honor. They don't feel that they're sick or something like that. They feel that they're being honored, and that's therefore I think we have one of the highest rates, healing rates in that ward.
Can you share with us some special challenges you may have faced because of the COVID pandemic?
Yes, I can. One of the drawbacks in this COVID is the isolation which the patients have to go into. They have to be isolated. They get isolated from their parents, or from the children, from the brothers and sisters, from their friends, from whatever they actually know. They're there with the four walls. And to make them feel much better, we have to connect with them. We have to be in touch with them. During the week, it's much easier. We have all different kinds of options. On Shabbos, we have a bigger problem because everything's electronics. So what we do, allow people to go in, even though they use the electronic doors, and they have to be Mechalel Shabbat, because to leave these patients by themselves, it's really, really pikuach nefesh. And some of them even say they don't care about the sickness. The isolation is what really gets them. So therefore, we make sure that nobody feels isolated over here.
Thank you very much, Rabbi Hoffner. We certainly appreciate you joining us this evening.
Thank you as well. Good evening to everyone.
Good evening. Our next guest is Dr. Linda Harrell, Assistant Director of Obstetrics and Gynecology at Mayaneha Hayeshua. She's been at the hospital since it opened 30 years ago. Dr. Linda Harrell, thank you very much for joining us. We certainly appreciate you being a part of this evening.
Thank you.
My pleasure. So you are the Assistant Director of Obstetrics and Gynecology at Mayaneha Hayeshua. You've been with the hospital for a number of years, and there is a history there. Going back, you've watched the hospital grow and plant roots in the community. Can you tell us a little bit about that history, in addition to the joy and what I would imagine are the obvious challenges of delivering babies in the time of a pandemic?
Our patients are safe and they're comfortable, and they love coming to us because they know that they get good professional care and respect for their wishes and for their priorities. Now we take this population and put this into a pandemic when a woman who has 12 kids at home, and one of the kids came home from school with the virus, and everybody else in the family even if they have a large apartment, when you have 12 kids and 2 parents in one apartment, they're all going to catch, or almost all of them are going to catch the virus. And then when a patient comes in childbirth and delivering, and then has to go back when she knows that she's contagious and she wants to keep the baby healthy and safe. All of these are challenges that we have specifically a little bit more intense than in other communities where a large family is 2 children, a dog, and a goldfish.
I would imagine there are certainly some very unique challenges when you're working in a community like B'nai Brak. Perhaps you can share some insights with us about what you and your team have learned about perinatal infection over the course of the past several months.
Well, our first cases of women who came in to deliver when they were known or diagnosed with the virus were in March. And since March, from March until now, we had over 120 deliveries of women who have the virus. In the beginning of the pandemic, we tried to keep the mothers away from their newborn babies. We would allow them to pump milk and have another loving person care for the baby until the mother recovers, because we were very afraid of that the mothers may transmit the disease to their neonates. Now, the coronavirus is not transmitted vertically meaning that from the mother to the baby through the womb, through the uterus. The babies who do get sick, they actually contract the virus from their mothers or from somebody sick breathing on them and giving them through the respiratory system. So we kept the mothers away from the babies, and it was very traumatic for the mothers and for the babies and for the staff, because this is not natural. And after a few months, we realized that even those mothers who demanded to have their babies and use their masks, their babies did not get sick. And even those who were tested positive were asymptomatic. So we became much more liberal. And now almost all of our patients who do have the disease and come in to deliver, they get their baby to be together with them. And they're rooming in, and the mother takes care of the baby as soon as she's capable of being one-on-one with the baby.
Well, that's wonderful to hear. I'm certain that in a time like this, when there is separation from families and there is separation from loved ones who you would typically surround yourself with when it comes time to deliver, that having that added level of care and attention and empathy and human touch, even if it's through gloves and gowns and protective gear, means a lot to the women who are coming into the hospital to deliver their children.
Absolutely. And this is another one of our challenges, which is actually worldwide. We have to consider, when treating women with the coronavirus, we have to consider, of course, the patient's safety and the baby's safety, but also the safety of the staff, which is why when we come in with these suits that look like space suits with a mask and an eye cover and gloves and boot covers, and it's not really possible to recognize who's talking to you. So we try to be extremely empathic, and we do spend a lot of time one-on-one with the patient and discussing and apologizing for the way we look, actually. And since these women also have to be away, they're not allowed to have somebody together with them during childbirth, neither their husband nor any other supportive people that they choose can come in, because we don't want them to contract the virus as well. So actually, we usually have a specialized staff of a midwife and a doctor who are constantly with the patient, giving whatever medical treatment is necessary, and lots and lots of support emotionally, because this is very, very challenging for the mothers. And we do a very good job. I mean, our patients love us. They love coming back to us. We have wonderful feedback. And we probably, I think that we have the most patients with coronavirus delivered in our country. We have, as I said before, we have over 120 cases of patients. that more than 60% of them were asymptomatic, but they tested positive, so they have to be treated just as if they had the disease.
Thank you, Dr. Linda Harrell, very much for being a part of this evening. We certainly appreciate all of the work that you and your team do. And thank you again for joining us tonight.
Thank you.
We are thrilled to welcome our next guest to this evening's program. Nachami Samuels is the Director of Family Therapy at Mayanei Hayeshua. Nachami, thank you so much for joining us. We certainly appreciate it.
Nice to join you.
Excellent. So let's start with a question that may be common. You may have been asked this before, but I'm sure all the folks at home here in Israel and the UK and Canada would like to know the location of the family therapy unit. Some might say that the hospital was taking a bit of a gamble by placing the family therapy unit in a place like Bnei Brak. What's your opinion on that?
Well, Bnei Brak is an Orthodox city, and the hospital is situated actually in the middle of the community, in the middle of the city. And when Dr. Rothschild wanted to open the hospital, the psychiatric hospital, which I must say the family clinic is in the middle of the psychiatric hospital, people thought he was crazy because opening up a psychiatric hospital in the middle of the Orthodox community seemed like a very big gamble. But he believed that we should be, as professionals, brave in opening a psychiatric hospital in the community to lower stigma levels and make it easier for mental illness patients to come and receive treatment, for them to be brave and receive treatment. And actually, that's what happened. He also prepared that they should have private waiting rooms near the treatment rooms, and also in the ward, they had family private rooms for meeting people staying in the ward, but people weren't using them. When the hospital opened, people preferred meeting other families dealing with the same issues they were dealing. They have groups that they see each other. Actually, I think there are family groups meeting in the wards twice a week with other families and talking about the same issues that they're dealing with mental illness. The Family Therapy Center was also some sort of a gamble because we weren't sure how families would react to coming to a center that's situated in a mental health hospital in the middle of Bnei Brak, in the middle of the city. But from a pilot that we started 3 years ago with 3 families, we grew very quickly. We're more than 30 families in the center when we think about an average of 6 children per Orthodox family. And there's a very long waiting list, and people are coming by themselves asking to be accepted to the Family Therapy Center to receive help as parents dealing with mental illness and needing helps of professionals with the children and with functioning as parents. And it's amazing to see how much the stigma levels are being lowered because of the center being in the middle of the city.
I think it's safe to say that many people would assume, even in the best of times, that having a family therapy unit in a very traditional, very Orthodox community would present a certain set of challenges, obstacles even. Now, add to that pressure a global pandemic, and you have nearly an insurmountable challenge. How do you and your team handle the delicate balancing act between your patients, their families, and the community that the hospital is such an integral part of?
Well, on a day-to-day, we believe in the Family Therapy Center of working together also with the welfare services in the city and also with the Ministry of Health, with the rehabilitation programs, and with the schools for the children. And the parents themselves have all kinds of programs that help them during the day with the children, like foster daycare, and clubs for the children during the day. And during the coronavirus, all these things stopped. And for parents who have problem functioning on regular basis, suddenly they had to become parents on a full basis. And it was very, very difficult, especially when a lot of these services were shut down and they couldn't receive the extra help that they were receiving usually. So we had to actually prepare a special plan. We had contact with these families at least twice a week with each member of the family. It could be with the parents, it could be with each parent separately, also with the children, and also treating also the family as a whole, but also separately. The psychologists really worked very hard during this Corona time. And I think we really did, we made a big difference during this time. And it was also due to all the hard work that they did at the time.
Excellent. Well, we appreciate all the hard work you're doing, and we certainly appreciate your contribution to the hospital in this evening's program. Thank you for joining us.
Thank you. Bye-bye. Thank you. Bye-bye.
Our pleasure. Once again, I'd like to say thank you to all 5 of our guests this evening. And on behalf of Mayaneha Hayeshua and What's New TV, I'd like to thank all of you in the audience who chose to spend part of your evening watching this program. If you have any questions or comments, please feel free to email mayanehayeshua.org. The email is on the lower third of your screen. And finally, a message from Mayaneha Hayeshua's Director of International Resource Development, Chaim Fachler.
Thank you, Jeremy. As Israel deals with this second wave of this pandemic, our thoughts are with our brave and conscientious frontline staff who are so conscientiously serving the community. More than ever, Yeshua is being called upon to deliver top-class treatment while continuing to protect the physical and mental well-being of all our patients and staff. We hope and pray that we will soon see a safer, healthier, and altogether better environment for us all. On behalf of all the international chapters of Yeshua, I invite you to support this very unique hospital in any way you can. To learn more about us and to receive our newsletters, please visit our new international website. Thank you all for joining us this evening. Stay safe, and shalom from Mayaneha Yeshua.